Hello, everyone.
Hello.
We are so excited to be playing Nurse Squad tonight. It's been a number, like usually we do every other week. I feel like it's been.
It wasn't. It was before we went on the cruise in
I know.
Florida. Yep, it's been a month.
Oh yeah, and we both got off of the cruise and got sick, and then so that was sad. But on the upside, I did win like this nice trophy on the cruise.
You guys, she was so good. We were sitting at the pool. Pool deck games, and we just were there by accident. Like we didn't go like to compete in this. We were just like sitting at the pool, like chatting, drinking our little drinks, whatever. And Cathy's just like nailing these games.
Oh yeah,
she's so good.
It was bingo, right? But I did it. It was a little more hard because you had to get like the X. It wasn't just like regular bingo, right? So,
and you know us, we are very competitive, and so once we realized that we were playing in a game, we were like, it's go time.
Totally. And then so we were also enjoying a glass of champagne while we were playing, and and then when I got my X, I got up and I was like shaking my booty all the way to the front to get my prize, and then but then in the back of my mind I thought, everybody's watching me. And I thought, if I messed up one of these and don't win, how embarrassing would that be after I just did this celebratory dance all the way to the front of the stage?
Oh yeah. Oh my God.
But luckily it was a legit win, right? So
we had so much fun. It was such a good time.
Totally,
we had a blast. Yeah.
Totally. So in Miami, before we got on the cruise ship, we played Nurse Squad. We played Nurse Squad Farm, and Team Cathy.
And Cathy tried to trick Team Meris, by the way. I don't know if you guys were here for that.
Yeah. So this is for all of the team, people who were on Team Cathy. If you were here last time on Team Cathy, let's go. Let us know. Anyway, enough gloating. So tonight we are playing a very special version of Nurse Squad. We also have giveaways that we're so excited to tell you about because we can't help ourselves. Yeah, for sure. So tonight we're going to play the NCLEX version of Nurse Squad. So you guys know, or maybe some of you don't know, we have 8 different Nurse Squad games. So here's 4. Let's see if I can hold these all up without dumping them everywhere. Meris always does a good job with that. There it is. Yes. So there's 8 games. And typically we play one subject at a time. So last time we played farm, but tonight we have combined questions from all 8 of the Nurse Squad games to use for our NCLEX review. Today is Team Meris's day. We'll see about that. We will see about that. And so how many people out there are studying for the NCLEX now? How many people have graduated or getting ready to graduate and are studying for the NCLEX? And how many people?
NCLEX season, besties. It is NCLEX season.
Totally. Oh wow, I'm ready. Yes, Ashley, because you are Team Cathy. So okay. Mandy's taking NCLEX next Friday. NCLEX, nice. Now, who here has not played before? Who's played and who has not played? So I know Sarah Elizabeth has played. I know that name very well. Entering senior year and doing a general review over the summer. So smart, Sarah. And we would expect nothing less from you. You just passed it last week, actually. What a relief. And you are here playing with us still. So that's so awesome.
Oh my gosh.
So you're going to be an amazing nurse, still trying to learn and review even after you pass your NCLEX. Okay, so
Rebecca, you should email us, by the way. Email us at what is it? Support@leveluprn.com. And let us know let us know that you passed the NCLEX so that we can share the good news with the team. And
Okay, so a lot of people here have not played before. A few have played.
Welcome.
Yeah, totally. You're welcome. Every time someone asked in the beginning, how do I sign up for the live? You just attend. It's free.
Just show up.
We're just here having fun, helping you learn stuff, showing you our Nurse Squad game, which as I was pulling questions out of each of the decks, I was like, these are the best. These games are like the best, you know?
And also, if you love a satisfying package, look at, the magnetic close, well, that's upside down. The magnetic close is, to this day, like, I have ADHD and I will literally sit here and fidget with this sometime because it is very satisfying. I'm obsessed with these games. I love that we have this. I wish I had this when I was in nursing school so badly.
Totally. Well, and it's just, I love everything about it. Like, the questions are like the questions that you get tested about in nursing school and on NCLEX. So like the questions are like spot on. And then the other thing I love, it's just all the hazards. Like, so I pulled some of my favorite hazards out of each of the decks.
I didn't even think about pulling, like,
So you could, because we're working with all of the different games.
Right.
I pulled one out of health assessment, one out of med surg, and one out of fundamentals. So, so like Meris showed you, it comes in a really nice box, just to kind of give you an overview of what's in our Nurse Squad game. You get the really nice box. Inside, we have avatars that you can choose to play as. There's 8 different avatars, which have like different skills and powers. So who you playing as tonight, Meris?
You know, so you guys know, normally I go with my girl Willow. Look at her and her glasses. I feel like we would be best friends. But today I'm feeling big Adam the Advocate energy today. I don't know.
Nice.
I love him. He doesn't get enough recognition on the squad, in my opinion. Adam the Advocate, and also, if you've never seen his blurb, it says, Adam champions inclusion, speaks up for his patients' needs, and doesn't back down from making his concerns heard.
Nice. All right. So Meris is playing as Adam. I'm sticking with Izzy. Okay. I was sick for almost 3 weeks after this cruise, and I worked out for the first time yesterday, and it nearly killed me. Okay. So usually I got like the guns going. I work out all the time, but I am like it's amazing how debilitated you can get in 3 weeks. I had the worst time working out. And anyway, so I was thinking about patients in the hospital who are there for like a week and how debilitated they get when I felt so bad after being sick for a number of weeks, Yeah. Anyway, all right. So I'm going to be Izzy. The other thing you will find in each of the Nurse Squad games are hazard cards. So these are cards that you can play against your opponent if you want to play competitively, which is how we do here. So you don't have to play competitively on your own, but we definitely play competitively here because
it's just who we are as people.
Correct. So we break up the audience into Team Cathy and Team Meris. So Meris, you want to tell them who's on? Yeah. Let them know who's on what team. Okay.
All right. Best friends, I'm begging you. You gotta listen up. Okay. If your handle, so not your legal name, but the handle that shows up when you comment. So DD, for instance, starts with a D. Then if your handle starts with A through L, you are on Team Cathy. You answer Team Cathy questions.
Yes.
If your handle begins with the letters M, like Meris, through Z, then you are on Team Meris and you answer Team Meris questions. Okay, so comment and let us know which team you are on so that we can correct you if you are wrong.
Totally. So let us know. Are you Team Cathy or are you Team Meris? Yes. Again, if your handle is A through L, you are Team Cathy, and M through Z, Team Meris. Correct. Nice. Oh, lots of Cathy. Okay. No, there's some Meris. And you got Sarah Elizabeth. She's on Team Meris. So, yep. Okay. Team Cathy. You got my Sheen. Okay. Yeah, you're good. You've got some really.
I have some ringers, so it's gonna be.
You're fun. Not worried. Yeah, neither one of us are worried. We're yeah, right. Totally.
I'm not worried at all.
And I'll tell you what, the people who come, like who have our Nurse Squad games and like come to Nurse Squad regularly, those are the people who are like killing it in nursing school. Like ooh, like they are rocking it out. So if you're new here, if you're new to Level Up RN or don't know about us, we can help you get through nursing school with flying colors and pass that NCLEX in 75 questions. So All right, everybody knows. Okay,
Team-
okay, Rhoda, you are, the Team Meris.
On Team Meris,
Yes, right.
Jessica, you are on Team Cathy.
Jessica, you're with me. Jean,
or Jean,
you are with me.
You're on Team Cathy. As much as I hate to lose you,
right?
As much as I desperately hate
say goodbye to Team Meris because you're coming over to me now. You're with me. So we are going to do two. So, we didn't finish going through the whole pack. Okay. So we talked about, sorry, we get distracted sometimes. We have fun and we're navigating who should be on what team. Anyway, so we went over our avatar cards.
We did.
We talked about our hazard cards. Which hazard card did you pick out?
I picked out combative patient. I was at Skills Day today for my hospital, which, by the way, enough, I'm at Skills Day, which, people from all over, like whatever. And this sweet lady came up to me and was like, I know you. And I was like, you know me? And she was like, you and Cathy helped me pass the NCLEX. And I was like, oh my God, like, it was so cool. But we were talking at the very end of Skills Day about combative patients, de-escalation, restraints, whatever. So this one, obsessed. This one says, the patient in room 27 is upset and getting combative. Use that therapeutic communication you've learned to de-escalate the situation before things get out of hand. Thanks to your training, you've at least got a fighting chance. And look at his cute little butt. Just
and the boxing gloves. That's amazing. It's amazing.
It's so good.
Yeah. So each of the nurse squads has 8 hazard cards that are unique to that deck, right? So we've got 8 games and 8 hazard cards. So there's like 64 different hazard cards, unique. I love patient transport because I know it's amazing because I was a transporter. I had to work as a transporter during nursing school. So patient transport.
And you can't see, but on his little sign there, he's holding, it says to CT. Like your ride is here to take you to CT.
Totally. I was forever taking people to CT, like all night long. So room 19 needs to go to CT, and it looks like you're the chauffeur today. Get ready to navigate the hallways and get your patient to radiology on time. So super cute. So again, when it is your turn, you can choose to play a hazard card on your opponent. And what that means is that whatever question is at the top of the deck, that team or person needs to answer it correctly, or they lose 4 points from their score. And if they get it right, they don't gain any points, but they don't lose any points.
And 4 points is more than any individual question is worth. So that does a lot of damage. So yeah.
Totally. And then the other thing in the box, of course, are the question cards. So we have 1 point, 2 point, and 3 point questions. So the 1 point questions tend to be a little easier. 3 point tend to be a little harder. And because we're doing NCLEX, I kind of mixed them up from like fundamentals, from pharm, pediatrics.
Yes, just so you guys don't think this is rigged, I did purposeful placement of these so we didn't get like 12 pharm questions in a row or whatever, because we're trying to cover the spread, friends.
All right. And like I said, about halfway through, so maybe about 5:30, we will do our first giveaway of the evening, which is going to be our brand new academic year planner, which just got delivered. So I'm like, Meris is going to be salty. She doesn't even have one yet. And we're going to ship one. We'll have Deanna ship one to you tomorrow. But
okay.
This is the 23-24 academic year planner, just arrived very shortly. So we're going to give away one of these guys. And then at the end of our game today, we are going to give away a 12-month membership to our Level Up RN membership. So that is a big deal. And we'll talk more about the planner when we have you guys kind of sign up to be entered for that giveaway. And we'll talk more about the membership when we have you guys sign up for that. So definitely stay with us.
And if you win that planner, then you're going to have one probably like same time that I get it. So you're going to be like super exclusive. It's going to be amazing. So yeah.
Totally. Yeah. The planner is totally amazing. I know. So, okay. So this is, what's this?
Great
I don't know.
point.
91 peeps and only 23 likes. All right.
Listen,
so,
and you guys, Angelina isn't here today. Angelina isn't moderating. Deanna is moderating, and you guys don't know Deanna, which I say as though you like intimately know Angelina, but you know Angelina. Deanna, I don't know, she might want even more likes. We haven't even talked to her. So yes, I feel like if Angelina trained her, she's going to be looking at that like count too. So very, very appropriate call out. We appreciate you.
Totally. So if you find this helpful, which I know that you guys will, because we go over really important questions, we talk about them, we sometimes ask follow-up questions. I know people learn a lot on these sessions, so we're excited to play for sure. Okay. And everybody say hello to Deanna. So you don't see Deanna, but she's filling in for Angelina today.
She sees you.
Oh yeah, I know. We need to get Deanna on here to like sing and stuff too. She's like a professional singer as well. Okay. Nice. Yeah, for sure. Okay. So the way this works, everybody knows if they're on Team Cathy or Team Meris because there's like a little banner on the screen to tell you. So in case you forget, so it's right there. And then we're just going to take turns asking questions, and everybody gets 1 minute to answer the question. So do you want me?
Yeah, I feel like Team Meris needs to get the
first question
asked first. For
okay. All right. I have a fundamentals, practice and skills question for 1 point. Are you guys ready?
Right. We're so
and
ready.
Just put and answer in the comments if you are Team Meris. If you are Team Cathy, then nope. Okay. How many fingers should fit between a restraint and the patient?
Listen, I was just saying. That's what I was just doing today. Do we know the right answer?
All right. How many fingers? Oh, there it is. That took like 0 time at all. Nice job, Team Meris.
Correct.
Nice job.
Also, this is a thing that trips people up in clinical practice that I just want to clarify for you. 2 fingers doesn't mean like this. It doesn't mean like that you should be able to fit 2 fingers stacked on top of each other. It means like this, that you should be able to fit 2 fingers. If I can fit 2 fingers this way, they can get their hand out of there.
Too loose, right? That's not going to be really effective. That's a good point. That's a really good clarification point for sure.
Yeah.
All right, Team Cathy, we're ready, right?
You guys are definitely
yes.
Because this is you got this, no problem. This is a point.
So Laura, your team Cathy, okay? A through L. So Laura, Team Cathy. Yep. All right.
Nicole. It has my initials engraved into it also, which you totally can't see, but I know I'm very fancy. This was my $13 Etsy
nice.
wristwatch. Okay. All right. 1 point health assessment question.
Okay.
Are you ready?
We are ready.
What is the function of cranial nerve 6?
Cranial nerve 6. What does cranial nerve 6 control? All right, Team Cathy, if your handle's A through L, now's your time.
So not the name.
Can I do I can't do a, okay, yeah, but what kind?
What kind
of eye movement?
Uh-huh.
I shouldn't do it, right? I can't.
No.
Yes, but yeah, it's still not good enough. You gotta say close. You gotta see what those. Tell us what the eyes do. What the? I'm not gonna use my hands. Sorry.
Yeah. Oh boy, what kind?
Eye movement. Okay, yeah, but what kind? Because there's different kinds. Yes.
Yes.
Lateral eye movement. Nice.
Yes, so
I was trying not to go like this or like this.
Outward movement of the eyes. Cranial nerve 6 abducens. It abducts the eyes, right? It's going to cause the eyes to go away from the midline.
Right. And so the weirdo way that I remember this is abducens is like abs, and someone's like, I've got a 6-pack abs, but they really don't. So you kind of look to the side like, really? You know?
Love it.
Totally like, yeah, like, I don't think so, dude. But anyway, so you can remember cranial nerve 6, 6-pack, and abs, okay? And the little lateral eye movement.
I love that.
Okay.
Yes.
We've got.
So remember, the reason why we didn't just accept eye movement is because cranial nerves 4, 5, and 6 are responsible for movement of the eyes. I'm sorry, 3, 4, and 6. Nerves 3, 4, and 6 make your eyes do tricks. So there are multiple cranial nerves involved.
Yes.
So you got to be more specific.
Totally. And yeah, so Elizabeth is asking, are these cards available for purchase? Absolutely. So on our website, leveluprn.com, you can get just one game. If you just need one subject, you can get the Fab 4, you can get all 8 games. And if you buy the packages, you definitely save money on that. So
yes.
So Dee Dee, yeah, I'm glad y'all appreciate my weirdo humor. So there you go. All right. So we also have a health assessment, but it's a 3-point question.
Ooh.
Okay. Describe the anatomical location where the mitral valve can best be auscultated.
Okay. So the question is asking, describe the anatomical position. So where would you listen to auscultate what was it?
Oh, sorry. I just put it down. It's describe the anatomical location where the mitral valve can best be auscultated.
Mitral valve, which also has
the specific location.
So you're correct. Yes. All right. There we go. Yes.
Okay, but we need more. We need.
Yeah.
Okay.
Fifth intercostal space.
There's a little more information needed besides fifth intercostal space. Add the extra thing we need to know.
There's 2 things actually, technically.
No.
Yes.
Yeah. Okay. Yep. Okay.
But also,
but which side?
Which side?
It's mid-clavicular, but is it
left? On the left side, yes.
Okay.
Yes.
Oh wait.
Yes.
What did I say? Left clavicle? Okay. Are we cobbling together all these answers here?
Yes. There's one that says on the left side.
Okay, good. Okay. Right. Everybody said left there. So the answer is fifth intercostal space, left mid-clavicular line. And that is where you can hear the mitral valve.
Because remember, we can listen to things along the sternal border, right? Which means right up against the sternum in that space. We can listen to things on the mid-clavicular line, meaning in the middle of the clavicle. We can even listen to things on like mid-axillary, different parts of the lung, whatever. Fifth intercostal space, you got 2 of them and they wrap all the way around your back. So you got to be more specific.
Totally. Okay. You guys that was down to the wire. That was down the wire, but y'all got it. So good job. Good job. All right. We're ready for our Team Cathy question.
Team Cathy, you are getting a 2-point pediatric nervous system question.
Okay. We're ready.
Here we go. What type of therapy is often used to treat strabismus? What type of therapy is often used to treat strabismus?
And I probably can't explain what strabismus is because
For sure not.
Oh man! All right. So how do we treat it? What is the treatment for strabismus?
Pediatric.
That's a test.
That would be diagnostic.
Yes.
There it is.
Nice.
I'll take that. Patching, occlusion therapy. Patch the eye. You already got the points, but which eye? Which eye are you going to patch?
Are we patching the affected eye or the unaffected eye?
And they're going to ask you. I mean, just promise you, they're going to ask you.
Totally. Which eye are we patching?
Correct.
That's right. The unaffected eye. Because we're trying to get those muscles stronger in the affected eye. We're trying to make them work.
They could also call that the strong eye, the strong side, because you can also have you can have strabismus with 2 weak eyes. You're going to patch the stronger one. So yes, unaffected or strong or good eye or whatever is how they're going to do it, because we want the good eye to take a break so that this one has to work harder.
And get those muscles stronger. So nice job. Okay. It's my turn to ask you one, right?
Yes.
Okay. We have a pharm, respiratory system, 1-point question. The nurse should educate patients to do what after administration of an inhaled glucocorticoid? The nurse should educate. Yeah. Then, yeah, you got to know this one.
We have talked about this in regards to me and the fact that I don't do this, even though I should, when I take my inhaled glucocorticoid.
You don't rinse your mouth out? What?
Cathy, you just answered.
Okay. All right. Oh, man. I got to give you all a different question. Well, they got it right too. They did it. There was oh man, I totally just gave away the answer for Team Meris. But also, WTF, I'm not rinsing your mouth out. Like, what? What?
I shocked her so badly.
And I totally messed up and gave you the answer.
Yeah. Why is because I'm lazy, if we're being very honest.
Girlfriend.
And also, I'm a bad patient. I'm a great nurse and a terrible patient. Rose doesn't either. Thank you, Rose.
You're bad too, Rose. What's up with Meris and Rose not rinsing? Okay, dude, I'm here to tell you, you're going to get asked a question about rinsing, like having your patient rinse their mouth out after an inhaled glucocorticoid.
Listen, I never missed the question. Just don't do it in real life.
Just don't do it in real life. Okay, and honestly, there was like, I think they answered at the same time that I gave away the answer. So Team Meris was going to get the point. So it's fine. But I'm sorry, Team Cathy, I blew that one. I'm sorry, my throat's a little, I'm still got like this lingering cough thing from getting sick. I'm like, when is this going to be over?
We got like some kind of weird plague or something. Yeah.
Doesn't make me super excited to get on a ship with a couple thousand people again, you know?
I know.
Anyway, we're ready.
Maternity newborn question.
Okay.
Oh my God. Sorry. I'm getting old and I am finding I'm having a hard time accommodating for near vision. So I had it up here and I was like, I can't read that at all.
Okay, girl,
all right, here we go.
Okay.
How frequently should the nurse apply lotion to an infant receiving phototherapy for hyperbilirubinemia? How frequently should the nurse apply lotion to an infant receiving phototherapy for hyperbilirubinemia? Cathy.
All right, y'all. Never! That's right, never! And I'm like, I was like, that's a trick question. You can't, anyway, it is, but it's a good question.
Has no poker face.
I seriously cannot lie at all. Like, if you all were here, how many people were here for the Miami version 3 weeks ago? Okay, so what I did is I came up with some ridiculous question for pharm. And it was like, what enzyme is, like, I mean, just some random thing.
Which cytokine is mediated when taking, infliximab or like whatever? And I was just like,
But I was like so excited to try to trick Meris up and to do this fake question that I didn't really ask it very well. And I was all flustered because I can't lie and I can't.
But also, I wrote 95% of the pharm questions. So I was like, I didn't write that question. And she was like, yeah.
I know. And then I broke right away. I'm like the worst faker ever. Totally. Okay, good job, Team Cathy. We never apply lotion when a baby is having phototherapy.
This is my favorite answer of all of them.
Don't do that.
Don't do that. So good.
Yeah, that's amazing. Okay, good job, guys. All right, we've got, it's time for giveaway, isn't it? So let's take a little break. We'll get back to questions in a minute. So our first giveaway is our 23-24 academic year nursing school planner. Looking so beautiful. This planner is amazing. In the planner, I don't know how many people are familiar with our planner or not. But we won't go over like tons of details, but one of the things I love the most I don't know, Meris, you might like, I love our reference sections in the back. Our reference sections have all the things you need for every single class. It has all the lab values. It has all the cranial nerves. It has all the expected ranges for vital signs, BMI. It has, you know, types of precautions. It
lab
has
panels, restraints, and ordering information there. It's got the information on isolation precautions, all of the motor milestones, the psychiatric, all the garbage you got to know for peds is in there. Vaccine schedule. I mean, man.
It's so good.
Cool.
Oh, and Sarah says, I don't know how, but I drag my planner everywhere and it somehow still looks new. Well, Sarah, so
I
durable,
know how.
y'all.
I know how. It's because your girl is a planner person. And so I know the things that suck and the things that don't when it comes to a planner. You think those reinforced corners were accidental? They weren't. That was very much on purpose.
And look how thick the you know, the covers are, and you've got, this thing is built to last. It's so good, you all. I love this planner. And so someone's going to win this.
Oh, wait, I have the thing.
Good. That's great. Cause I don't have the thing.
Okay. I have the thing, but I'm going to write it down. Okay. Are you ready? If you want to win, then you need to type this phrase in the chat box. Listen to me closely.
Only one time.
Yeah. If you put your name in, if you type it twice, Deanna is going to strike you from the record and you will not be eligible to win. Okay. Yep. So one time, Deanna, pick me. Once you put that in the comments.
Right. Okay. So if you want to win a planner, then put Deanna, pick me. And while everybody is entering, we can talk about some of the other, briefly talk about a few of the other features in here. So
first and foremost, I want to say that this was designed based on a lot of experience of the things that do and do not work when it comes to planners. Your girl has ADHD. I have all the intention in the world of being able to use a planner, but if it is difficult to use, or if I can't see everything that's going on at one time, I'm not going to use it. And that is important for neurodiverse people, but it's important for the neurotypical people too. So we have it set up so that everything is as clear as it possibly can be. You have a weekly overview where you can see where you're supposed to be for labs, simulation, and clinical, along with what your homework is for that thing. We have a section here for assignments, tests, and quizzes. We have things for you to do otherwise in your life. Like if you've got your to-do list, I need to do the laundry, make a doctor's appointment, whatever. We have stuff so you can track different habits. We have a study tracker because we know that it is consistency that builds a habit and matters for your study habits. We have place for you to plan your monthly view. We've got place for you to track your goals. And every single month, we give you a pep talk and a test taking, studying, or clinical tip so that you know you are not alone, that the nurse squad at Level Up RN has your back and is thinking of you and everything that we do, and that no matter how alone you might feel, you are never alone. We are always in your corner. And we did that all in this little guy. How cool.
Yeah. It's super awesome. Super rugged. And honestly, the reference pages are worth the price of admission alone, honestly. Having all that stuff in one place. Yeah, for sure. For sure.
Okay, so I'm gonna say we're gonna cut it off.
Cap it off now.
In 5, 4,
all right.
3, 2, 1. All right, that's it. We're done.
Okay. So Deanna, we'll give Deanna here a few minutes to pick a winner while we continue to play. Okay.
I just want to say this comment too. I think the tip of the day calendar is gold as well. If anyone is thinking about picking that up, you could not be more correct. I love this little thing so very much. And I have working nurses that I've given this to or who have got it themselves that I know in real life who are like, I love seeing this every single day. There's so much stuff that I don't remember from nursing school.
Totally. Okay, so Deanna, let us know when you have a winner, and we'll continue to ask questions. So who asked the last question? Did you ask us? What was the last question you have in your asked question, like thing?
Hyperbilirubinemia.
Yeah.
Yes.
That was the last question. So now you have a pediatric cardiovascular system 2-point question. Okay.
Okay.
This one is really important, y'all. In what position should a child be placed when they are having a cyanotic episode? In what position do you place the child?
This is so important that knowing it was cardiovascular, when Cathy said, in what position, I knew the answer immediately because that's how often this comes up. So Team Meris, yes.
There it is.
Yes. Heroes. Amazing.
Yes.
Amazing.
Knee chest position. Nice job, y'all. Nice job.
Knee chest position. And there's another way that this could show up. This could be called cyanotic spells or episodes or whatever. It can also be called TET spells, as in tetralogy of flow. So don't be, if you see TET spells on NCLEX, don't be like, I don't know what that is. It's just cyanotic episodes.
Right. It's a combination of 4 defects and it makes it really hard for the child to breathe. So,
yep.
You guys all right. All right, you guys. Yep, we're ready. Psych. Yes.
Okay. This is a 1-point principles question. During which phase of the nurse-client relationship should the nurse discuss confidentiality and establish boundaries?
Okay, so we have different phases of the nurse-client relationship, and we do different things during the different phases. So during which of the phases would we discuss confidentiality and establish boundaries? Because those are important things to kind of level set on. Orientation.
Nice
job, Jonathan. Thank you. Yep, orientation. So that's great. And then the working phase is like when you do like the actual work of like building, skills to be more resilient and deal with whatever the mental health issue is. And then termination is the next one, right? Which is where you kind of rehash kind of what has been accomplished and then the patient sometimes has a feeling of grief because that's the thing they ask about with termination.
And this was always confusing to me in nursing school because I was like, I cannot, they often couch this not in mental health terms, but rather just like in the nurse-client relationship, like in the hospital. And I'm like, this is not, nobody is really, I mean, yes, sometimes, but nobody is really feeling a sense of grief that they're like leaving the hospital and not going to see the nurse that they had for like 3 days,
Right.
This is talking about like the person who's in like PTSD therapy or like in rehab or something, and they like are building this rapport and working through these issues together. And then they are very sad to be leaving that working relationship. So I always thought, I was like, what do you mean grief? And then I was like, oh, we're applying this way too broadly.
Right. And sometimes in nursing, this is one of the things, like you're not going to talk about these different phases of the relationship when you're like a practicing nurse. This is like nursing school NCLEX world, right? Like I've never been like, okay, we are in the orientation phase of our relationship. I mean, I don't know, maybe somewhere, some place they're talking about that, but never an environment I've ever been in. But you have to know for nursing school. And so that's what we're here to help you get through. Okay. And the NCLEX and being a good practicing nurse as well. But there's certain things we have to teach you that are like, you got to know this for nursing school, but then you can kind of like not worry about it anymore. Okay.
Yeah.
All right. This is a really good question. We got a 1-point nutrition question. A patient with dysphagia, i.e. difficulty swallowing, may benefit from therapy with which type of interdisciplinary team member?
Gotta know this.
Yeah, you do.
If you have watched a video of mine ever, then you know that my go-to phrase is learn it, love it, get a necklace that says it. You have to know this.
Okay, so which interdisciplinary team member are you going to call? Yes, your speech language pathologist. And they're going to be your buddy if you're working on a med-surg floor or whatever. They're going to be the one to test the patient's swallowing and recommend a diet for the patient.
Yes.
So and then the doctor just signs off on it.
We love our SLPs. Oh
Yes.
my gosh, yes. So SLPs are very helpful for a myriad of complaints in the hospital, but yes, if they are having issues swallowing, that is who you want to call.
Okay, do we have a winner yet?
We do.
We do. Okay, you want to announce the winner of our planner?
I was thinking I would let you announce it because...
Okay, because it's easier?
Yeah.
It's mostly easy. Okay, the winner of our planner is Kathleen with a K. Kathleen Caruso Midgley. God. See, Bears did not perfect because I am like the worst pronouncer ever.
I thought this is so good.
Midgley. You just wanted to see me pronounce that last name.
I thought you were going to be like, oh, this one's so easy.
It was, well, you know how
I think it's Midgley. Kathleen Caruso Midgley.
Oh my God, Midgley. I am so sorry, Kathleen. If anyone's going to butcher your name, it's going to be me. I tried. Yep, Kathleen, I did try. And so, Kathleen, where are you from? Are you in the U.S.? I hope you are, because if you're international, then we got to come up with a backup prize for you. But tell us where you're from, Kathleen. Okay, she's laughing. She's okay. She's all right. She doesn't mind. She won. She's like, whatever. Say my name however you want, lady. It's all good. Okay. Illinois. Okay, awesome. So yeah, we could totally get it to you. So
yes. Send us an email, support@leveluprn.com. Let them know that you won the planner. Give them your name. They will handle it. I'm so excited. Yeah, we're gonna probably get ours on the same day because I'm not terribly far from Illinois. So
totally. Okay.
But if you were just staying on for the planner giveaway, don't go away because we have another giveaway.
Yes. Yep.
Okay.
We have the 1-year membership, which, oh my God, it's almost top of hour. So we got to give away that. Oh. Yeah. Should we go ahead and have people sign up for it now to like give it time? Yeah.
Yes.
Okay. So do you have another?
I don't.
Okay. All right. So our next giveaway is a 1-year membership on our website. So the membership is awesome. And this is $100 value. I'm pretty sure it's $100 value.
Oh, yeah.
And it includes all of our videos. So probably like 600 videos without ads. It includes over 1,000 review questions.
Oh, I've got one. Sorry.
Okay, good. It's got over 1,000 review questions. It has our cram courses. So somewhere earlier.
Yes, I was going to say, somebody was asking, do you have a PEDS NCLEX review?
Yes, we do.
Sure do.
Yeah,
sure do. It's in membership.
So we have a PEDS cram course, which is basically a review of the most important topics and facts that you need to know for PEDS. And we have a cram course for all of the subjects on our membership. So if you are studying for NCLEX, if you're just studying for one subject, we've got you covered because we have all of the subjects there. So we have our cram courses. We have our dose calculation course on there, which is huge and awesome. And then we also have contact hours too. So for those of you who maybe are an LVN or LPN and also getting your RN, but you need to have your contact hours, we got you covered. That's included as part of membership as well.
Review questions for all of the subjects. So that we have like 1,000 or plus review questions for every, all of the subjects. We have a test taking and studying strategies like review thing within the NCLEX. Like there's so much there that isn't available anywhere else. So trust me, you want this.
All right. Yeah. And Lily, I crushed my farm ATI because of it. That's right. Awesome. That's amazing. Okay. So if you want to enter to win a 1-year membership, what should they type in the comments, Meris?
You should type members only.
Nice.
Right?
Right. Okay. So I'm so old that I remember the jackets, the members only jackets.
That's what I'm referencing.
You're not old enough to know members only jackets. Like, what are you, like 3? Like what? I mean, because I was pretty young, so
yeah,
I really wanted a members only jacket, but like it was just a regular old jacket with a little members only thing, but everybody wanted it because that was like the thing. Well, I guess it's just like now people wear sweatshirts with like Supreme, like
right.
it says Supreme. So it was like the Supreme stuff of like long time ago, right?
Yes. Yes,
okay.
It was.
Members only. Okay. So, and only enter once. Again, if you enter more than once, Deanna's going to throw your entry out.
Also, I've seen this question a couple of times. Do we have things to support next gen NCLEX? Yes, 110%. Because what I need you to, so first of all, we have videos that Ellis has recorded about what next gen is, how the questions are set up, blah, blah, blah. Couple of things to remember. The majority of the questions, like 85% of the questions, will still be in the format of the previous generation. Additionally, please remember that the facts don't change. So everything that we are reviewing with you is still the same testable nursing knowledge, okay?
Correct.
So yeah, you still got to know this.
And honestly, it's better because you get partial credit on multiple choice, okay? Because that wasn't a thing before, right? It was like an all or nothing thing.
Select all, yeah.
Yeah, or sorry, not multiple choice. Select all that apply. You get partial credit, which is amazing. You don't have to memorize lab value ranges, right?
They give them to you.
They give to you, which, you still have to know the significance of high and low and what the implications of that are, but they will tell you whether the patient's labs are high or low. Like you would see at a hospital with their lab report, right? It'll show it, flag it if it's high or low. So, honestly, I think next gen is pretty cool. I wish, I think it would have been great. So no one should be scared about this. There's a lot of really good things about next gen. And honestly, we're gonna teach you the information you need to know. And you just need to apply it to the questions. So all right. Okay, so everybody is entering. If you want to enter that 1 year membership to get it's members only, and everybody get in.
Right, ready?
3, 2, 1. Okay. All right. So we're gonna keep playing for a few more minutes here while Deanna picks a winner. I did speech language pathologist. Is it?
Yes. Okay.
Yep. I asked you about that, and so you asked me the next one.
Oh my God, sorry.
I know we're both hacking over here.
Woo! Yeah, doing great. This is a 2-point integumentary system question. Okay. Which type of precautions are required for a patient with shingles, Team Cathy?
All right. What kind of precautions do we need to put our patient on who has shingles? Which is caused, I can't say, anyway, I'll stop talking. So what kind of precautions? I know I want to help and give hints.
Yes, airborne and contact.
Yep, correct. Airborne and contact.
Both of them.
Yes, yes. Well, we had to combine like the left mid-clavicular and the,
Yeah, but I feel like when there's like 4, when we'll let them just shout it out.
Sure. Yeah, for sure. For sure. So contact and airborne. And it does depend, once the sores are crusted over, then you're good, right? Then they no longer have to be on airborne or in contact precautions. But initially, yes, airborne and contact. Okay. Yes. Good job.
All right.
I've got a med-surg 1-point renal system. Which type of incontinence causes small amounts of urine loss from sneezing, coughing, or laughing due to a weak pelvic floor? So there's different types of incontinence, and what kind is this?
Laughing, coughing, sneezing, all.
Yep, there it is. Stress incontinence. Nice.
Yes, they all increase the pressure within the cavities of your body. And so you will end up putting pressure, increasing the pressure, and then it's just physics. And if I have a really strong muscle, right, that really strong urinary sphincter, then it's going to be great. But if I have weakened pelvic floor muscles, then it's just physics. You're just going to leak some. Yeah.
Yeah, and Lily, yeah, you're right. Kegels is definitely a part of the treatment plan for someone with stress incontinence to try to strengthen those pelvic floor muscles. So nice job, Team Meris.
So smart. They're
I
so
know
smart.
they are. Everybody's so smart.
2-point immune system pharmacology question.
Oh, is it infliximab? I think that's the one I was making stuff up about
get
last
me
week.
back.
Okay.
No, this one I feel like is pretty straightforward. You guys will know this. Which antimicrobial drug class has a side effect of tooth discoloration in children?
Oh, this is a good one.
Gotta know it.
Yeah, so we would never give this antibiotic to children under 8, right? And pregnant people.
Patients. Yep.
Mhm.
Yep. Because
of this
in utero.
Yep.
Yes.
Tetracycline. And the way we remember
someone give me an example of a tetracycline, by the way. Like just
what's an example
that's not part of it. I just want to see if you know any.
Oh,
yes,
there's an example. Nice.
Excellent.
Nice. So our cool chicken hint for remembering some of this is if you play the game Tetris. How many people out there are familiar with the game Tetris? So Tetris has all these little blocks that come down on the screen. So all these little blocks look like teeth, right? And the fact that there's all these different things tells you that tetracyclines treat lots of different things, because they do, right? They treat STDs, they treat Rocky Mountain spotted fever, they treat
so many things.
Yeah, so many things. Yeah. So they look like little teeth.
Remembered, this is really dumb, but people have different brains. I remembered tetra meaning 4. So I always thought there's 4 things I need to know about this. And I mean, there's more, but don't give it to a pregnant patient, a breastfeeding patient, a child under 8, or don't take it with milk and dairy. And so, yes, it causes permanent
tooth discoloration.
Yeah,
yep.
Exactly.
Yep. And that is heavily tested on. So that was a really good question. Heavily tested on. Okay. Does anyone else start doing Kegels as soon as someone mentions them?
Yeah, like reflexively. Of course.
That's amazing.
It's like if I said, are you aware of your tongue right now? Well, now you are, and you're going to be for the next 2.5 minutes. So yes, I'm with you, Lindsay. Anytime somebody calls something out like that, I'm like, oh man.
All right, Team Meris. This is a 1-point psych disorders. Which personality disorder is characterized by lying, manipulation of others, and violation of social norms? This is an important one in psych.
This is an important one. And
and it doesn't sound like it's what it is. That's the only hint, though. I don't know why I'm giving you a hint anyway. Wait, so I'm going to put my timer down. Team Cathy's like, shut up, Cathy. Why are you doing that? Okay.
So lying, manipulation.
Yes. It's antisocial personality disorder. Which sounds like someone who just doesn't like to be around other people, right?
Yes. So, Anna, I love that you say this, because psychopath is the term that used to be used previously. Somebody who has narcissistic personality disorder, antisocial personality disorder, and histrionic personality disorder, we would put those 3 together, call it cluster B now, but we would call that psychopathy. But that is not the term that is used now. I never heard that. Yeah. Yeah. Antisocial personality disorder is what you are thinking of as a psychopath. That's not a term that is used. But yes, so that you're exactly right. Yeah.
Right. It's not someone, antisocial is not someone who just doesn't like to be social and be around other people. It's someone who lies, manipulates, history of violence, cruelty, all that stuff. So, okay. Good. All right. Your turn.
Sorry, I zoned out. I was like, yeah, all right.
Well, we both do it from time to time, so we'll just keep each other straight. It's all good.
3-point fundamentals, practice, and skills question.
Oh, wait, hold on 1 second. My teacher says type B, it's all about me. That's amazing. I love that clue.
Cluster B. Yeah, cluster B is what you'll hear it called.
I said lying, manipulation, and violation of social norms.
And there's a lot of other things too, like there can be cruelty to animals in childhood. There can be like run-ins with the law, and like there's a lot of different ones there because not everybody presents the same with it. But there's a lot. Okay, ready? 3-point.
Okay.
Skills question. Which I don't really
know wait. So I haven't played a hazard on you. Can we choose?
Oh.
It's our turn, right?
You can choose to play a hazard.
Should we play a hazard on Team Meris? We should. I didn't even wait for y'all to answer. We definitely should play a hazard on Team Meris. Let's play this scabies card. Y'all want some scabies, Team Meris? All right, Team Meris. You have scabies. Your newest patient has a pretty severe case of scabies. The charge nurse asks you to apply permethrin cream in an attempt to quell the infestation and keep it from spreading to other patients. A job you are absolutely itching to do.
Hilarious.
That's amazing. You do have to apply it head to toe, just like that. I mean, maybe not so close to the eyes, but for sure, head to toe, right? All our pictures are just like a little exaggerated. They're just kind of fun. Okay, so we have a 3-point labor and delivery,
which is no problem because Team Meris definitely has watched the maternity playlist. We've got this.
Okay, here we go. The nurse notes a gradual decrease in the fetal heart rate after a contraction has started. What is the likely cause of this form of deceleration?
Guys, so there's a 2-part question here because first you got to know what kind of a deceleration that is, right? So it's a gradual decline that occurs after the peak of the contraction. So what kind of a decel is that? And then what causes that? You got to be able to 2-step this.
So okay, if you're Team Cathy, first of all, if you're Team Cathy, you need to shut it.
Yes.
Right, all right. Nice.
Yes. Placental insufficiency. Yes, exactly.
Lily girl, you are with me. You're Team Cathy. It's fine. Someone on Team Meris answered right. Placental insufficiency is the answer. So you guys avoided losing 4 points. So congratulations on that.
Thank you very much. We appreciate that.
Yes. All right. And maybe this will be the last one, and then we'll announce the win. Oh, are you gonna? Oh, she got to play a hazard on us.
Yeah. Just like Mr. Smith or whatever his name is, we're gonna throw hands. All right. You ready?
We're ready. Okay, so Team Cathy, A through L. We got to answer this right, or we lose 4 points.
Here we go. Explain how to empty a closed drain, such as a Jackson-Pratt drain. So walk me through the steps, my friends.
On how we close it or empty it?
How you empty it. Like, what are all the steps? What are you going to do? You have been asked to empty this Jackson-Pratt drain.
All right, take us through it. It's going to be a long comment, so just... Okay, we're going to release the pressure first. Okay.
Open the cap.
Yep, we open the cap, release pressure. Then what do we do?
Then you try not to panic as time runs out.
People are just, assess it. Yep, we want to assess it. Yep. People are typing. See, they have lots of types, so that's why it's just taking just a little longer.
Yeah, I'm sure that's why.
No, dude. No, Team Cathy, man. They're like on it. Okay.
Pour it into the container. Yep.
Open top.
So now it's empty. Now what are you going to do?
Open it, enter, and then squeeze it, close, and put the cap on.
Man, Laura just under the wire.
Nice job, Laura.
Yes. Yep. Open the cap, pour the contents into a measuring canister, compress the canister, and replace the cap. Yes, absolutely correct.
Okay. And we have
congrats on not losing 4 points also.
Okay, so here's what we'll do. We'll announce the winner of our 12-month membership, and I can say this name. I can, so I'm going to announce it. Meris is like, we'll see about that, and then we will add up our points and see if Team Meris or Team Cathy won. Okay. So the winner of a 1-year membership is Austin McClellan. Austin McClellan. Are you proud
nailed
of me?
it, Cathy.
I did. I nailed that pronunciation. Super proud of myself right now. All right. About emptying a drain. I'm in term 3 and never heard of this.
It would be during fundamentals is when you would most likely possibly med surge, but I would say overwhelmingly likely in funds.
Yep. Okay, so Austin, congratulations. Definitely reach out to support@leveluprn.com. They'll get you all set up with your 1 year of membership. So congratulations. And emptying JP drains is something you'll do a lot on the med-surg floor if that's what you, for sure. And you actually get to pull out the drains as well, which is not anything I learned in nursing school and is also really painful. So because I'm a wound care nurse. So a lot of times my patients have like a wound and they have drains, like maybe multiple drains. And the nurse comes in, they're like, I got to pull out the drains. And I'm like, not until I'm done with my wound vac dressing change, because what you're about to do is way more painful than what I'm doing.
Rile them up.
We're not doing that right now. Just give it a few minutes. So, okay. Should we add up points now?
Yes, a 1-year membership, I believe, Kathleen, is $100.
Yeah, I think it's like 99. I think it's like 99. Yeah. It's $10 a month, or it's $99 a year. And there's so much good stuff on membership that we described earlier. All of the ad-free videos, over 1,000 review questions. Our cram courses are like just beautiful and will help you so much. Studying for NCLEX, studying for your proctored exams, whatever it is you're studying for. Okay.
Yeah. And yes, Lily, she is indeed a badass. That is very true. Very true.
Right back at you, lady. Okay. We got ER, emergency and trauma certified nurse over here. And wound care nurse certified. Here. Yes. Wound care certified nurse. Yeah, right there. I love
very chef's kiss indeed. Yes, I agree.
Okay. All right, let's add up our points. 4, 5, 7, 8, 9, 10. You know what? I feel like I gave you too many 1-point questions now that I'm looking at it. I just shuffled it, but you got 10.
What I'm hearing is collusion and sabotage.
You got 10 points. I don't think I did a good job of getting higher. Okay, I feel like I rigged it.
We got 11 points though, so I'll take it.
Okay, what'd you get? We got 11. No, this is how this is your points, right? This is like I asked you these questions and you get.
Oh wait,
girl, we got 11. These are your questions that Team Meris answered. So that's 10. It's all good, girl. I totally butchered the name earlier, so you're allowed to.
The brain, you know what? Is not braining.
It's 8 p.m. What? It's 9 p.m. Eastern. It's all good. You better drink. What are you drinking over there? That's just water, right?
No, it's just water. Yeah, I know. I'm like,
what is that?
I can't even blame it and be like,
9 o'clock at night. All right. So just to be clear, Team Cathy won by 1 point. So
because of collusion and sabotage.
No, just because I didn't really. So here's our trophy, y'all. GOAT. Greatest of all time. Yes. So this is for you, Team Cathy. Rejoice.
Oh my God.
Congratulations. And I think someone was asking.
Austin, I'm going to take back that membership.
Okay, I hope everybody had fun and learned some stuff, had a good review session.
Yes. Somebody asked when the next one is, and we haven't firmly picked it yet. We have so we are picking it at the end of this week. We will be able to communicate with you when it is. So keep an eye out. We do these routinely. We had to take a little break because I moved and then Cathy was traveling and there was a whole lot going on. So we will be back on schedule. So if you have not already signed up for our email newsletter, please do that. We are not related, although this is my favorite question of all time. We get asked
Totally.
this all the time.
For
I wish
sure.
we were, but we are not.
Right.
But
Totally. Yeah. People think we're the same person sometimes.
okay.
So that's a little like, really? Okay. But then like the related part, like that's cool. Like I could see
Yeah.
that, right?
Yeah. Yeah.
We're both
Oh,
kind of passionate, like we kind of both passionate about nursing, both have brown hair and
we've
glasses.
got the
and all that good
glasses
stuff.
and, you know.
Totally. Totally. Totally.
But yeah, so sign up for our email list. If you haven't already, go to leveluprn.com, put your email in there. That way you will be the first to know. And we will see you back here whenever we do this next.
And we can't wait to do it again. So maybe the next time we'll do another NCLEX. Maybe we'll just stick to the NCLEX since a lot of people are. Yeah, I feel like the variety was good. And I know a lot of people are studying for NCLEX. So anyway, definitely sign up for our newsletter so you can get notified. And we would love to have you next time. So thank you so much for joining us tonight, guys. Good luck with school and studying.
Bye.